So my presentation is on vitamin D requirement during lactation, high-dose maternal supplementation as therapy to prevent hypovitaminosis D for both the mother and the nursing infant. So as we've learned before, rickets is a softening and a weakening of the bone due to a lack of vitamin D, calcium, or phosphate. Rickets was thought to be eliminated in the United States approximately 40 years ago until the past few years when they've noticed that exclusively breastfed infants of darker pigmentation tend to be lacking in vitamin D. This is mainly because darker skinned individuals require a much higher exposure to UV light to produce the same amounts of vitamin D as lighter skinned individuals. Previous studies have shown that vitamin D supplementation and exposure to UV light can increase vitamin D content in breast milk. So a bit about vitamin D. The current adequate intake for lactating women is 600 IU per day. This was changed in 2009, but keep in mind all people 14 to 70 years old in good health are also recommended 600 IU per day. The adequate intake for infants 0 to 12 months is 400 IU per day. As many of us have learned, we use adequate intake because at this time we do not have enough information to establish an estimated average requirement or a recommended dietary allowance. The upper limit for vitamin D is 4,000 IU per day, but this only results in adverse effects if taken for a long time. One study showed if you take this levels for 7 years, you might get kidney stones. The toxicity threshold is estimated to be about 10,000 to 40,000 IU per day, but there have been studies that show light-skinned individuals who are exposed total body to 10 to 15 minutes of UV light can release approximately 20,000 IU per day of vitamin D. So as we can see, there's a lot of debate on what the recommendations for vitamin D should be. So the purpose of the study was to determine the effects of high-dose maternal vitamin D supplementation on the nutritional vitamin D status of mothers and their nursing infants. The hypothesis was that vitamin D intakes up to 10 times the DRI among lactating women not only would elevate maternal nutritional vitamin D status to safe, healthy levels, but also would supply the nursing infant through milk transfer with adequate vitamin D to prevent hypovitaminosis. So keep in mind, this study was done in 2004, and the DRI at the time was 400 IU per day. So in this study, it would be about 6.5 times the recommended intake. So subjects were fully lactating women when within 1 month of birth who were breastfeeding and planned to do so for the next 3 months. The original sample included 64 women who were enrolled, of whom 29 stopped breastfeeding by the first visit, and of the remaining 35, another 17 left the study after the first visit, leaving only 18 remaining, a major hindrance and problem in this study. But as can be seen by this table, the remaining 18 women who were split into 2 groups were relatively similar. The researchers didn't find any major differences that could cause errors. So this was a randomized controlled trial. Each subject served as her own control by comparing her baseline vitamin D status, this was with no supplementation, to her vitamin D status after 1, 2, and 3 months of supplementation. The women were randomly assigned to one of 2 supplementation groups and were instructed to take the given capsules daily. Group 1 received capsules containing 1,600 IU of vitamin D2. Group 2 received capsules containing 3,600 IU of vitamin D2, and both groups received a multivitamin capsules containing 400 IU of vitamin D3. To let you know, vitamin D2 is the version of this vitamin that we do not produce endogenously through exposure to UV light. That is vitamin D3. Vitamin D3 is also the most common dietary vitamin we find in our bodies. Vitamin D2 mainly comes from fungi. Mothers were also informed to limit their sun exposure for both them and their infants, and to limit formula intake for the infants. So mothers weren't exclusively breastfeeding. So during the study, blood, urine, and milk samples were obtained from mothers 4 times during the study, each a month apart. 1 serving as baseline, and then the 3 months during supplementation. Maternal serum was monitored for total calcium, vitamin D2, D3, 25 hydroxy D2, and 25 hydroxy T3 concentrations. Just as a reminder, 25 hydroxy vitamin D, it was mainly measured because it's the most prominent form of vitamin D in our bodies and has the longest half-life. Urine was monitored for calcium and creatinine ratio, and milk was measured for anti-rachitic activity. Anti-rachitic activity is a measure of concentrations of vitamin D2, D3, 25 hydroxy D2, and 25 hydroxy D3. So they kind of just lump them all together. Infant blood samples were taken during visit 1, the baseline, and visit 4, the end of the study. They were also monitored for the same things as maternal serum, along with phosphorus concentrations, due to its association with rickets. So let's first look at the mothers. So group 1 showed an increase in serum concentrations for vitamin D2, which is that one, with vitamin 25 hydroxy D2, which is this one here, and 25 hydroxy vitamin D, so both D2 and D3, the top one. They actually showed a decrease in vitamin D, 25 hydroxy vitamin D3, and no change in just vitamin D3. But a major thing to be seen is that all serum levels were below 50 nanograms per milliliter, which is considered the concentrations that can be dangerous. And no woman in this study suffered from any adverse health effects. Group 2 had similar findings with an increase in vitamin D2, 25 hydroxy D2, and total 25 hydroxy vitamin D. They had greater increases than group 1, but still remained under the 50 nanograms per milliliter, which was considered dangerous. They also observed a decrease in vitamin D3, 25 hydroxy D3, but unlike group 1, their vitamin D3 actually increased a bit. So for the breast milk, we have both group 1, which is the lower one, and group 2 on here, and we see both groups increase in their anti-rachitic activity with a greater increase in group 2, which was the 4,000 IU supplementation. This increase in the anti-rachitic activity was mainly due to increases in vitamin D2 and 25 hydroxy vitamin D2 concentrations. Okay, so for the infants, we see group 1 for infants. It showed an increase in 25 hydroxy vitamin D2 and 25 hydroxy vitamin D overall, and 25 hydroxy vitamin D3, but we need to keep in mind vitamin D3 does get produced endogenously, so it is questionable about that. A major thing to point out is that through current recommendations, a value under 12 nanograms per milliliter for people of concentration of 25 hydroxy vitamin D is considered a risk for developing rickets, and it's considered inadequate to between 12 to 20. So as we can see, these infants were actually very severely vitamin D deficient, and by the end of the study, raised to levels that are safe. We see a similar pattern in the group 2 with the 4,000 IU, with they started slightly higher, but they also had a greater increase, but still in safe, healthy levels. So currently, the American Academy of Pediatrics recommends that newborn infants receive no sun exposure for the first 6 months of life. But this is obviously an issue, considering that vitamin D produced endogenously through sun exposure is our major source of vitamin D. And as we can see, almost all the infants in this study were deficient at about the age of 1 month. So there is some issues there. So this study shows that a mother's vitamin D status does have an effect on her vitamin D status of her breast milk with high supplementation, and it may suggest that the current DRIs for vitamin D for lactating women may not be sufficient, and they may need to be increased, at least for that time.